I'm really delighted to kick off our very first informational webinar on wandering awareness and prevention for individuals and families. My name is Lauren Libero. I'm the autism specialist at the California Department of Developmental Services. I lead our autism services branch, and I'm really excited to have all of you here today to hear about this very important topic. But before we get started with the webinar, we have some housekeeping information for you. So I'm going to pass it to Jasmine, who's going to walk you through our housekeeping items.
Thank you. Hi, everyone. I'm Jasmine with the Community Engagement Team at the department, and just a few announcements before we begin. We're offering Spanish interpretation today. I'm going to give instructions on how to access the Spanish channel. Para escuchar esta reunión en español, haga clic en el globo blanco en la parte inferior de la pantalla que dice Interpretation. Después, haga clic en Spanish y seleccione Mute Original Audio. We're also offering ASL interpretation for today's meeting, and the interpreter has been spotlighted. Closed captioning is active, and this meeting is being recorded, and it will be made available on the department's YouTube channel. Materials are available for download in the new Zoom Resource tab, which you'll see in your toolbar. You may send written comments via email to autism@dds.ca.gov. Next slide, please. And just a few Zoom webinar tips. Chat is not available for today's webinar. However, you may use the Q&A button for questions and comments. And we'll have a Q&A session at the end of the presentation. So please submit your questions using that Q&A button. And you may also use the thumbs up icon to upvote any question. You can view today's slides in English or Spanish. Just hover your mouse to the top of your screen and select the tab for English slides or Spanish slides. And lastly, please take a minute to complete the survey that will appear when you leave this webinar. Thank you, and back to you, Dr. Libero.
Thank you, Jasmine. So we can go to our next slide. All right, I'd like to welcome our two speakers today. We have with us Kate Movius. She leads Autism Interaction Solutions, where she collaborates with individuals with lived experience to provide autism education to law enforcement and first responders. She has also worked with California's Commission on Peace Officer Standards and Training, specifically on the topic of wandering and prevention. And she also serves on the Los Angeles or LA Found Taskforce. With Kate, we have Tim Travis, who's the Director of Community Services at San Gabriel Pomona Regional Center, where he oversees and develops innovative and quality services for people with intellectual and developmental disabilities. He has been a strong advocate and very active in promoting water safety for individuals with disabilities and is committed to advancing safety initiatives. So please join me in welcoming Kate and Tim. And for today's webinar, I'm going to walk you through our agenda on the next slide. We're going to start with an introduction on wandering and awareness. We're going to include some of the data related to the risks, and then we'll talk about practical prevention strategies and information about a new water safety campaign. At the end of the webinar, we'll also be sharing a number of resources that you can take with you, and we'll have a bit of time for questions and answers before concluding our webinar. So I just want to thank everyone again for registering for the webinar and coming today. And with that, we're going to kick it off with Kate.
Thank you, Lauren, and good morning, everyone. I wanted to start, next slide, please. I wanted to start with a definition of wandering. So wandering is also referred to as elopement or eloping, and that doesn't mean going to Las Vegas. in this case. It means bolting away or running away, and it's when an individual leaves the safety of a responsible person's care or a safe setting. So that could be school, that could be residential setting, or it could be home, really anywhere. And most importantly, this behavior can result in trauma, injury, and death. Next slide, please. So the risks of wandering are many. They include drowning, traffic injuries and fatalities, encounters with strangers and misunderstandings, and encounters with law enforcement. But by far, accidental drowning accounts for the greatest number of deaths. So 90% of deadly outcomes for people who wander who are autistic or have developmental disabilities result from drowning. Other dangers include things that can happen when you're outside for a long time. So that could be dehydration or heat stroke, hypothermia if it's cold, if you're up in the mountains, injuries and falls, and physical restraint as a result of interacting with law enforcement. After the age of 7 years old, usually the risks in this behavior increase based on the severity of the autism. So under 7, it kind of balances out, but after 7, we see a huge increase in risks due to wandering in our population. Next slide, please. So let's take a look at some more statistics about this. 50%, or roughly half of children with autism, will attempt to elope or wander from a safe environment, and that's nearly 4 times higher than their non-autistic siblings. 40%, and as a parent, I think this is probably low, 40% of autistic children, of families who have autistic children have suffered sleep disruption due to a fear of elopement or their child going missing. More than 1/3 of children with autism who wander or elope are unable to communicate their name, address, or phone number. And honestly, they usually don't feel like they're lost. They may be running because it feels good to run. That would be my son. He loves to run, and sometimes he just needs to do that, even if it's not safe. Other individuals might have a goal in mind. They might want to run off to visit a person or a restaurant. And half of families who support a person who wanders report that they never received any advice or guidance about elopement from a professional. So if you think about it, if 50% of children with autism engage in this behavior, but only half of families know about it before it actually happens, that's a real gap. And that's why we're here today, to really help families put into place some safety steps. Next slide, please. So this is my son Aiden in the yellow, and my son James in the white shirts, with a team from the LAPD. This is 2014. My son Aiden had a critical missing incident. Our house had been locked down. We thought we had everything squared away. He had been working on this particular behavior for many years because he started doing it when he was about 3. So at 14, he went off into the night in Northeast Los Angeles. He was picked up. He had no clothing on, which was sensory, I'm sure of it, because he needed to take it off and he needed to feel the wind. I don't know. He was hospitalized briefly as a John Doe, or an unidentified juvenile. And that's when my 911 call missed and crisscrossed. And for about 20 minutes, I didn't know if he was alive or dead. All I knew was that he was at a local hospital. It was a very upsetting incident. It did end well for Aiden, but we as a family made some big changes because of this incident. And we're going to take a look at some of these in the following slides. Next slide, please. So we're going to do this in 7 tips because too many is overwhelming. So 7 tips to help prevent wandering and related tragedies. Next slide. First and foremost is swimming lessons and water safety. This is crucial. We talked earlier about the risk of drowning. This is also a really challenging step for families, and I want to acknowledge that. It can feel completely overwhelming, and it can feel like it's just beyond what we're able to do as parents to give our autistic children or developmentally disabled children swim lessons. We might not be able to swim. We might not live anywhere near a body of water, or so we think. This is still the most important step in safety. Now, the good news is that swim lessons can be funded through regional centers. They're also available at many YMCA locations. So if you feel that this doesn't apply to you or your child because either you or your family don't swim or you don't seek that out as a recreational activity, or even, we're going to get to this in a moment, if your child does swim and you think you don't really need to revisit this. This again is the leading cause of death from the behavior of wandering. So if you do own a pool, you want to be sure to fence it. Sometimes when people own pools, they get too relaxed. Their child learned to swim at a very young age. It's okay. Everybody's always looking out. You've got to fence that pool. You've got to make sure there's nothing sitting in the pool that would be attractive to the child. So that would be toys and balls, making sure that that pool is clear of toys. And again, I want to emphasize that just because a child knows how to swim doesn't mean they're safe in the water. It's a really good idea to know where all of the pools are, where all the bodies of water are around your house. And we have a miraculous way that we can do this now, and that's called Google Earth. So if you have a computer, you can get a computer, go to a computer, you can go to Google Earth and type in your address, and you go up in the air and you can see where all of those bodies of water are. I want to also remind everybody that when a child enters a body of water, an autistic child, they're often fully clothed, and that can also be a danger for them because it can drag them down. Next slide, please. So our next safety step is to secure your home inside and out. We made a big mistake with this as a family. We were using double-sided deadbolt locks. You can see that picture in the circle on the left. So this is just locking the door from the inside. That is a fire hazard. We learned that when the fire department and social services came to our home after our son had been hospitalized as a John Doe. They needed to do their due diligence. So this is a big no-no. It's also how my son got out. He figured out how to use the key. The best thing that we found was a keyless push button lock. You can see a picture of it up here on the right. This is not electronic, so if the power goes out, it still works. It is available online on Amazon. You just need to look up keyless push button locks and it should come up. Other options include a home security system. If that's outside of your budget, which it is for most people, just using battery operated door alarms or hook and eye locks, fencing your yard, using adhesive stop signs placed by the exit door. I always say this to families. Anything is better than nothing when it comes to these precautions. And by that, I mean you want to try anything you can just to make sure your child is delayed by just a few seconds or a minute or two when they're trying to go for that door or that window. So again, families often feel so overwhelmed because they think, oh my gosh, I can't get a whole alarm system. It's just too much. You don't have to do that. You just need to put into place some steps, and you need to ask for support if this does feel too overwhelming. Next slide, please. Third, we want to connect with our community. Knowing your neighbors can help reduce the risks associated with wandering. I know that this is not necessarily an ideal option for everybody. Not everybody has nice neighbors or neighbors who talk to each other. My hope is that you have one or two. We found this to be very, very helpful when my son was engaged in this behavior. Providing a letter to trusted neighbors, informing them of your child's tendency to wander can be very helpful. And in our resources, we actually have some downloadable templates and samples of these kinds of letters. And very importantly, you want to make a list of all the places that your loved one likes to go in the community. So this could just be your neighbor Charlie's house, the McDonald's down the street, grandma's house, a construction site. You want to have this all listed for yourself on your fridge and on your phone, because in the moment of a crisis, it's very hard to keep your head straight. And so being able to share this information with the people around you and with first responders will save a lot of time. Next slide, please. Fourth, we want to contact our local first responders. So this is both police department and fire. What does this mean, contact them? Well, it depends where you live, right? So where I am, it's LAPD. This is a huge police department. You might live in an area with a much smaller police department where you can just call or show up and ask to speak with somebody. It's on a non-emergency basis. In my situation, we call the non-emergency phone number. So this is not a 911 call. We explain that we're in the neighborhood and we have a son with, in our case, profound autism who has engaged in wandering, and we wanted to make sure that this local station has his information. We have down here, you can see the personal emergency profile sheet. That is a really good tool for passing out to first responders. And if you can bring your loved one to meet the first responders, that's great. Again, not an option for all of us, I understand. But if you can start familiarizing your loved one with first responders, what the uniform looks like, just so that there's that familiarity, that can really be helpful. Also, some police departments have a special alert system. This is a voluntary registry where the families provide their address and information about their loved one. And this is so that police can respond more accurately at calls for service. So this is really, really important. And I'm going to emphasize this again in a couple slides, which is that we need to provide our dispatchers, our 911 operators, with as much accurate information as we can, because then they're going to convey that to our responding officers. And that can really go a very, very long way toward ensuring safety for everybody involved. Next slide, please. Fifth, obtain a tracking device. So there are many different devices available, and each person with autism has a different sensory need and challenges. I never thought my son would wear a wristband, and he actually ended up wearing the one that you see pictured here. That's a Project Lifesaver wristband. He was trackable, which was a huge relief to us. How did we get him to wear this wristband? Oh, it was a full court press. It was everybody. It was school. It was his in-home behavioral therapists doing sort of exposure therapy. So putting it on for 10 seconds, taking it off, putting it on for 15 seconds, taking it off. He ended up wearing it for almost 2 years. So I always say to people, if my son could wear it, anybody can. But it's not the only option. This is a very good one, Project Lifesaver, because it's used to track the person in live time, in the moment. But anything is better than nothing. Remember what I said earlier. So you can use a clothing or a shoe tag. There's a program called If I Need Help, which is statewide, and they provide QR codes that you can wear. That may be easier for people. There's Angel Sense, there's GPS tracking. Again, there's so many options. I don't want people to feel overwhelmed. I also want you to know, again, that anything you do to make your loved one safe is much better than doing nothing. Next slide, please. 6, we want to create a safety plan for ourselves, not during the crisis. Again, another mistake that I made as a mom. So if you know that this is something that your child does, even by the way, if your child has never wandered, let's think about that statistic we saw at the beginning of this, which is that 50% of children with autism will wander. So it's really important to prepare for it. You want to address this issue, again, not by yourselves. You do not have to do this by yourselves. You do this in conjunction with the school in the IEP and with your regional center with the IPP. I really want to encourage people to reach out to those resources. Also want to be sure that the school knows all about this behavior and that they document every incident that occurs. So documentation is extremely important. We need to document the wandering behavior in the IEP, and we want to document any incidents that occur. Now, this child might just run out on the front steps for a second and come back, and they don't think that counts. It does, because that's the start of potentially of a pattern of this behavior. So you want to provide a letter to the district or an email to the district or the adult day program if we're dealing with an adult, and you want to request all information for all wandering incidents be conveyed back to you or back to the conservator. We have down here some more resources from the National Autism Association, fantastic resource. And also we have the National Autism Safety Council. These are two excellent resources for free downloadable booklets, guides, and templates for families. Next slide, please. Finally, wish I had someone who had told me this at the time. You want to create and post a 911 checklist for yourselves. So have it on your phone and have it on the fridge, on the wall, just ready to go. Because I can tell you, which I said earlier, when you're in a crisis, you don't know where your mind's going to go. You are definitely in kind of a fight or flight mode, and it's very challenging to get all that information out. The dispatcher will walk you through it, but you might end up forgetting something very, very obvious. So first and foremost, state your name and address. You want to state that your loved one is missing, endangered, and provide the diagnosis. This is extremely important. If those responding officers don't know that your child has autism and they're running along the street and they're not turning around to look when the officers are calling them, or they behave in a strange manner, in an autistic manner, really, and those officers don't understand it, you can see how things can go sideways. We want to be sure that diagnosis is right front and foremost in the information. Provide your child's name and then all the visuals. This is where my mind went blank, which is very funny. I mean, you just don't know what you're going to forget. I forgot how tall he was. I was so concerned and worried. I also forgot what he was wearing. So, word of advice, take a photograph, which is easy to do these days with the phone. Take a photograph of your child before they go to bed and when they go off for the day. So when they take off for school, or if they're in a day program, take a picture every day, 2 pictures every day, so you know exactly what they're wearing. And you want to then, as we talked about earlier, provide all the possible locations you think your child might be. I want to end with the 2 most important tips that I can give you. Always call 911 immediately. I am guilty of having waited 20 minutes because I thought I would be able to find him. That was a mistake. He got far, he got 2 miles away. Call 911 immediately. If your child, it turns out, is hiding under the bed, it's okay. It's okay. They don't mind. Don't feel that you've somehow wasted resources. And also, another reason people don't want to call 911 is they're worried about the police, and that's understandable. But this is a case of wandering and going missing. The sooner that you can get first responders involved, the better. And the second very important tip is check water first. always be sure to direct those first responders to water that you know is nearby. Even if it's the smallest body of water, a retention pond. Again, we can find all of these on our own computers and our phones on Google Earth. So call 911 immediately and check water first. And if we take these steps and we prepare for these incidents, it's my hope that we keep our loved ones safe moving forward. Thank you. Next up, we have Tim Travis with the San Gabriel Pomona Regional Center, and he's going to talk to us about water safety.
Good morning. Thank you, Kate. My name is Tim Travis. I work in the Community Services Department at the San Gabriel Pomona Regional Center. Our regional center is one of the 21 regional centers statewide and one of the 7 regional centers in Los Angeles County. First, I'd like to thank DDS for the opportunity to share information about our regional center's water safety campaign. Next slide. So May was Drowning Prevention Month, although we should always be vigilant, regardless of the season. As we head into warmer months and begin to enjoy California's waterways and pools, it's important to take water safety steps to prepare ourselves and our loved ones. As was mentioned earlier by Kate, drowning is one of the leading causes of death for children and young adults. Actually, Governor Newsom has urged Californians to spread awareness on water safety and help protect others from these preventable tragedies. In California, drowning is the #1 injury-related cause of death for children under the age of 5, and is the second cause of death for children ages 5 to 14, and the #3 cause of death for teens and young adults ages 15 to 24. Next slide. Each year, more than 430 Californians lose their lives to drowning. Many others survive, but may have long-term health needs. There are nearly 750 individuals receiving services from regional centers statewide who had experienced a near drowning incident prior to age 18. Individuals with intellectual and developmental disabilities, as mentioned earlier, including those with a diagnosis of autism, are at a higher risk of drowning due to the wandering and limited awareness to dangers. That's why prevention is especially important in our community. Most drownings happen between the months of May and August, and they often occur quietly, without splashing or cries for help. Learning how to reduce those risks around water is an important part of keeping everyone safe. Next slide. Through gracious funding from DDS and in partnership with the Prevent Drowning Foundation of San Diego, our regional center has launched a campaign to share information about water safety and drowning prevention in the community we serve. The Prevent Drowning Foundation of San Diego was awarded funding to assist our regional center in developing a swimming safety and drowning prevention campaign to help the individuals we serve and their families and our community learn about water safety. I'd like to introduce you to Ollie the sea lion. Now you may be asking yourself, why a sea lion? Well, for those of you who live near water or have visited California's beautiful coast and beaches, know that sea lions make a lot of noise. So we want our children and our adults to make noise to alert others if they are having trouble when they're in the water. Now, Ollie has been very busy the last few months promoting water safety throughout the San Gabriel and Pomona valleys of Los Angeles County. He was at the Azusa Eco Fair, our Family Resource Center's Information Fair. We do a partnership with the LA County First Responders called Sirens of Silence, which was held here at our regional center's office. We were at the Irwindale Aquatics Expo last month, and this weekend we'll be promoting our swimming safety campaign at the Azusa Public Pool at Slauson Park. If you're in the area, please come by our booth, get information about water safety and different ways you can make your home and pool safe, as well as also get an Ollie cape. At each event, we share information to help individuals and their families learn about water safety, like this postcard. It has important water safety tips on one side in Spanish and on the other side in English. Now, Ollie reminds us We need to use barriers or alarms to secure entrances like gates and doors that lead to pools and other sources of water like ponds and fountains. When people are near water, like the ocean or a pool, they should always be constantly supervised. We really want people to learn how to swim. Now, one of the things that we're finding out during our campaign efforts is that many parents and grandparents don't know how to swim. So we need to make sure that everyone in the family learns how to swim. If you're out on a boat in one of California's lakes, rivers, or the ocean, everyone should wear a life jacket. People should also learn CPR with rescue breaths. But again, as Kate mentioned, the most important thing to remember is if your child is missing, always check the water first. Every second counts. Next slide. Now, the San Gabriel Pomona Regional Center and Ollie have launched a social media campaign, sharing regular swimming safety tips on Facebook, Instagram, and X. Next slide. So here are some additional links to swimming information, both on DDS's website, as well as also San Gabriel Pomona Regional Center's website. And remember, Ollie wants everybody to do everything they can to keep you and your family splash safe. Thank you, and back to Dr. Libero.
Thank you, Tim. On our next slide, we have our resource links for you. We've been dropping these links also into the chat, and many of them are also on that resources button. And so we have lots of different free options here that you can download to help do some of that emergency planning that Kate was talking about. There's downloadable information that Tim was sharing about water safety. We also have some resources from the department, including our wellness toolkit. And we have an informational handout that has distilled the information from the webinar today. And so you'll have access to all of that information from today's meeting. We highly encourage you to share this with other individuals and families that you may know or organizations that you may work with. This is really critical information for all of your families and friends to have. So we do encourage you to share those out. We've also been recording the webinar today, and so all of our participants will receive a link to the recording, and it will be posted on the DDS YouTube page after the meeting. And so please feel free to share the link to the recording or our YouTube channel so that anyone who couldn't make it today can listen in to our webinar later on. And then we also include our contact information. So I'm going to have us skip ahead, I think, 2 slides. And we have the information for Kate. If you want to connect with Kate and hear more about the education that she does, her contact information and website is here on the slide. We also have the contact information for San Gabriel Pomona Regional Center and the link to their drowning prevention and water safety website. And then on the last slide, we have the contact information for the department's Autism Services branch. So you can reach us at our autism helpline. We have a phone number and email account. And then the link to our Autism Resource Hub is here for you as well. So if you want to connect with us, you want to hear more about this topic or autism, or you have families who have other questions, they can always reach out to us at any time at the contact information here on the slide.